In this video, we're going to talk about healthcare policy in America. Now, it's important to note that when we're talking about healthcare policy in America, we're often talking about health insurance. We're not talking about healthcare per se. Here in Canada, we talk a lot about deliverables and wait times and tangible things with the healthcare system that we can fix. Where in the United States, with their system is organized much differently, and they talk about health insurance a lot more than we do. So it's important to ask, what exactly is insurance? And insurance is a market for risk, and it's really risk pooling is what it is. Another term for it is risk transference. When you're trying to spread the risk of something happening over a lot of people. So when you imagine your house, if you did not want to buy home insurance, if you get there's a fire, you left something on, your house burnt down, there's some sort of other event, somebody drove a car through your front window, you need a new house. That's going to be expensive. And it would be a lot more expensive if you and your neighbor it'd be a lot cheaper rather, if you and your neighbor could get together and have an agreement that says, look, if my house burns down, it's going to be really expensive to replace it. So I'll tell you what, if mine burns down, you help me fix it. And if yours burns down, I'll help you fix it. And so that sort of agreement, they are pooling the risk. The idea is that they're going in together as a partnership, as a pool, and they're taking on the risk together. So ideally, nobody's house burns down, nobody has to fix it. If one of them, their house burns down, the other one will chip in and help. Now, there's some natural problems. Maybe one of these persons is riskier than the others, and their house is more likely to burn down, so maybe that's not fair to the other person. Or now that the neighbor knows that he's got a partner to help him rebuild his house, maybe he's going to start throwing wild parties. We call that moral hazard. Moral hazard is when you act differently when you have insurance. You do riskier things. Now imagine if that relationship could be expanded to lots of other households. And rather than just committing their own time to rebuild a house, they would offer money. So each house could chip in a few dollars into a big fund, into a big pool, and then anybody who had problems with their house burning down or collapsing or people driving cars through their front window, then they could take money out of that fund to rebuild their house. This is a better approximation of what insurance markets are. So conceptually, they are pooling risk. A bunch of people get together and they agree to share the risk if one thing happens. Now if it's a thing that doesn't happen very often, the insurance premium will be relatively cheap. If it's something that happens quite a lot and it's very risky, then their houses would be falling down a lot, and they would be spending a lot of money to rebuild them. So therefore, they would need more money in the pool, and then the premiums would be higher. So that's how we think about insurance. And insurance is a big part of the American healthcare system. People purchase health insurance, and they are pooling risk just the same way as people with health insurance. So can it work for healthcare? I'm not sure, and some research suggests that it may not. One is information problems. In our neighborhood, you have a pretty good idea of whose house burns down, of how people are living. You could get the houses inspected to make sure that they're safe before you join the insurance pool. Healthcare, it's a little different. You don't know what problems people are bringing to the table. Maybe they've got a genetic history of a condition that was going to affect them no matter what happens. You don't know that if you're going to insure this person or if they're going to be part of the risk pool. If you knew that, then presumably you would have to charge more money because you know that they're going to get paid out. If you're an insurance company, that's how you would respond. You would because you don't know the information, you would probably charge higher premiums, and you might not even let them in. You might deny them coverage and say you can't be a part of this. There's the moral hazard problem, that if people with more health coverage, if people know that they're covered, they might use the healthcare system more frequently. Think about here in Canada, we have sort of a universal health insurance that covers everybody and it's provided by the government. So we don't see a bill ever. But we go to the emergency room when we need to. So are people going to the emergency room, the ER, more frequently than they would if they had to pay for it? Probably. That's a moral hazard problem. Are they living recklessly because we've got free healthcare? I don't know if you'd say that per se, but people in Canada definitely think twice about going on vacation when they're going in the States because they don't want to incur high healthcare bills. Firm dynamics as well. These health insurance companies don't know who to let into the risk pool. They don't know who they can cover and how they can come up with an insurance product that really deals with complicated healthcare systems. And this is the kind of research, it's not new by any means. Kenneth Arrow, a famous economist who actually solves a lot of political problems using economic theory and the interaction between individuals and incentives, says that you can't have an insurance market for healthcare because what about prices? What prices do you charge? How do you know? The outcomes are uncertain. You don't know what sort of people have going on as they present themselves. You don't know what their genetic background is. You don't know if they're already ill when they try to apply for insurance. And then, of course, just trying to do what's best for society, and a healthy, long living population might not work with an insurance market. So prices are a problem. The whole idea of information, uncertain outcomes. And then there's sort of a conflict with what the private insurance company might want to do with what a government might want to do in terms of advancing social good. So health insurance is a tough one to make work. We can do it for cars, we can do it for housing. For healthcare, it's a little tougher. As such, there are 4 different types of healthcare models. We could look around the world and we could see a bunch of different ways of dealing with healthcare. And we can kind of see them around the world. So the beverage model, as it's called, is the government provides healthcare. A perfect example of this would be the United Kingdom with their National Institute of Health, their National Health Service. What covers everybody in the country. All the doctors work for the government. When you go to the hospital, it's a government-run hospital. The government provides health care. So the United Kingdom has a beverage model, which means the government provides health care for everybody. There is also a NHI model, or single payer. NHI means National Health Insurance, single payer. This is what we have in Canada, where the doctors are private contractors. Hospitals are owned by regional health associations, and they're run privately, but the bill gets paid by the government. So the doctors that are sort of private independent contractors don't bill the citizens that use the system, they bill the government, and the government pays everybody. So it's a one huge insurance policy that covers the entire population. When we think about insurance and how it works, this is a relatively cheap option because you've got more people in the pool. You've got more people that are sharing the risk, and so therefore when it's only one person taking out the insurance policy, the government, then they can keep costs a bit lower. Some of those costs are offset at higher costs elsewhere. But the NHI, National Health Insurance model, is a single payer system. So sometimes when American presidential candidates are talking about health insurance reform, they talk about single payer. There is also the idea of what's called the Bismarck model, and this is inspired in Germany, but this is a sickness fund where your employer facilitates contributions to a large pool of risk, and so it's like insurance facilitated by your employer, and similar to a pension fund, it's like a sickness fund. And in some countries you can take that with you. If you change jobs, you still get the same allocation in the sickness fund. In countries like the United States, you don't. It's sort of specific to your job. Your employer provides the health care, and then if you leave, you don't get that policy anymore. You have to get a new health insurance policy at your new employer. But it's an employer-based model of sickness funds or employer-provided health care. That's the Bismarck model. And the final model would be the pay cash, out-of-pocket, pay-as-you-go. So this is the purest form of free market health care, where you have to pony up and pay the hospital, you pay the doctor, you pay it as you use it. So those are 4 different models. There's government provides healthcare, government provides insurance, employers facilitate insurance, or you just pay cash. Now the big question is, what system does the American government use, or in the United States, which system do they use? And the answer is all of them. It depends on what you do. If you don't have any health insurance, then you pay out of pocket. If you happen to be either retired and below a certain income level, or just younger and can't afford healthcare, you've got a low income, then you would be covered by the NHI model, the single payer, which is Medicare and Medicaid, which are types of single payer insurance. If you are in the military or if you are in Congress, you get the Beveridge model. You get government provided healthcare. And if you have a job that provides healthcare for you, you've got the Bismarck model. So the American healthcare system, we think of it as for profit. It's actually all of them depending on who you are. Some people are covered by a single payer, Medicare and Medicaid. Some people that are active duty or retired servicemen get government provision. People that don't have any health insurance, they pay as they go, they pay out of pocket. And the majority of Americans have insurance through their employer, which is the Bismarck model.